I need to share something with you today that has been weighing on me for a long time. And I know that the moment I say it out loud, some of my colleagues in medicine are going to take issue with me. But after years of clinical practice, after watching what happens to real people when they follow every recommendation that comes their way without questioning it, I cannot stay silent about this any longer. Here is what nobody in medicine wants to admit publicly. Sometimes the worst thing you can do for your health after 60 is agree to every test that gets offered to you. Now, I can already hear some of you thinking, wait, is this doctor really telling me not to get checked? Is he saying prevention does not matter? And the answer is no. Prevention absolutely matters. Catching real problems early is critically important. What I am saying is something far more nuanced, and it is something that could protect you from a cascade of unnecessary procedures, anxiety, and complications that can genuinely diminish your quality of life. I am Dr. Charles Anderson, and today I am going to walk you through 4 specific medical tests that I routinely see causing more problems than they solve in adults over 60. I am not doing this to frighten you away from your doctor. I am doing this to give you the knowledge you need to ask better questions, make more informed decisions, and become an active partner in your own healthcare rather than a passive recipient of protocols that may not be in your best interest. Before we get into the specific tests, there is a concept I need you to understand, because once you see it clearly, you will never look at medical testing the same way again. Doctors call it the cascade effect, and it is one of the most important and least discussed phenomena in modern medicine. Here's how it works. You go in for a screening test. You feel perfectly fine. You are living your life, feeling healthy, enjoying your days. The test comes back showing something, maybe a small spot, maybe a shadow on an image, maybe a number that sits slightly outside the expected range. Now, that finding might be completely harmless. It might have been sitting there for 20 years and would sit there for 20 more without ever causing you a single symptom or threatening your life in any way. But once it appears on a report, the machinery starts moving. Your doctor sees it and feels obligated to investigate further because what if they ignore it and it turns out to be something serious? So they refer you to a specialist. The specialist orders a more detailed test. That test shows the same ambiguous finding, still not clearly dangerous, still not clearly harmless. So now we are discussing a biopsy, or a procedure, or additional imaging in 3 months, and each of those steps carries its own risks. Infection, bleeding, anesthesia complications, radiation exposure, and perhaps most damaging of all, months of escalating anxiety that corrodes your mental health and steals your peace of mind. When you finally reach the end of this cascade, 9 times out of 10, the conclusion is the same. It was nothing. It was never going to hurt you. But by that point, you have endured weeks or months of worry, possibly undergone invasive procedures, possibly suffered complications from those procedures, and you are measurably worse off than you were before that first test was ordered. All because a screening found something that did not need finding. That is the cascade. And it begins with a single test that may never have been necessary in the first place. With that framework in mind, let me walk you through the 4 tests I see triggering this cascade most frequently. The first test is whole-body screening scans. Full-body MRIs, or CT scans, marketed directly to consumers with promises of catching everything before it becomes a problem. You have likely seen the advertisements. Come in for a complete scan. Peace of mind in 30 minutes. Know everything that is happening inside your body. It sounds incredibly appealing. The idea of comprehensive knowledge, of being ahead of any potential disease, that speaks to a very deep human desire for control and certainty. But here is what happens in reality. Imagine you are 67 years old. You feel excellent. You are active, engaged, enjoying life. You have no symptoms of anything. You decide to get one of these scans as a precaution. You lie in the machine for half an hour. A few days later, you receive your results. And right there in the radiologist's report, something is mentioned. A small nodule in your lung, 3 millimeters in diameter, or perhaps a cyst on your kidney, or an area of concern on your liver. The report recommends follow-up imaging in 3 to 6 months. Now, think about what has just happened to your psychological state. You walked into that facility feeling healthy and confident. You walked out carrying the knowledge that something exists inside your body that a medical professional thinks needs watching. For the next 3 months, every cough makes you think about that lung nodule. Every twinge in your side makes you wonder about that kidney cyst. Sleep becomes difficult. Your appetite changes. You find yourself researching worst-case scenarios online at 2 in the morning. 3 months later, you return for follow-up imaging. The finding is still there. It looks roughly the same, but the radiologist cannot say with certainty that it has not changed slightly. A specialist consultation is recommended. The specialist, exercising appropriate caution, suggests a biopsy. And a biopsy is not nothing. It means anesthesia. It means a needle entering your lung or kidney or liver. It means risk of bleeding, infection, and other complications that increase with age. And here is what the research consistently shows. When you scan healthy adults over 60, you find something unexpected in almost everyone. The medical literature reports incidental findings in approximately 90 to 95% of whole-body scans in this age group. Tiny cysts, small nodules, minor irregularities, spots that are as normal a feature of a body that has lived for 6 or 7 decades as wrinkles on a face. They are the internal equivalent of age spots. But once they appear on a medical image, they cannot be ignored. And the cascade begins. Studies tracking people who received these comprehensive screenings found no improvement in survival compared to people who did not get scanned. The scanned group did not avoid more diseases. They did not live longer. But they did experience significantly higher rates of anxiety, additional testing, unnecessary procedures, and the complications that come with them. The scans did not make them healthier. In many cases, they made them sicker. What should you do instead? Focus on how your body functions rather than how it looks on an image. Can you walk up 2 flights of stairs without significant difficulty? Can you rise from a chair without using your hands for support? How is your balance?
How is your sleep quality?
How is your energy throughout the day? These functional measures tell physicians far more about your actual health status than any image. And if something in your daily function changes, if new symptoms appear, that is when targeted imaging based on specific clinical questions becomes valuable. The second test is brain MRIs ordered for ordinary age-related forgetfulness. Here is the scenario I encounter regularly. Someone in their mid-70s notices they occasionally cannot recall the name of an actor they enjoy, or they walk into the kitchen and momentarily forget what they came for, or a word sits on the tip of their tongue for a frustrating few seconds before arriving. Their adult children, understandably concerned about cognitive decline, encourage them to get a brain scan to make sure everything is okay. I understand that fear completely. The prospect of losing cognitive function is one of the most frightening aspects of aging. But ordering a brain MRI for mild, ordinary forgetfulness is almost never helpful and is frequently harmful. And here is why. When you receive the results of a brain MRI at age 75, the report will almost certainly contain language that sounds alarming. Mild cerebral atrophy. Age-related white matter changes, small vessel disease, periventricular hyperintensities. These phrases sound like they are describing a brain that is actively deteriorating. But in reality, they are describing what every brain looks like at that age. It is the neurological equivalent of scanning your skin and being alarmed that it shows wrinkles and sunspots.
Of course it does.
That is what 7 decades of living look like. The problem is that medical terminology does not sound benign. It sounds like disease. And suddenly, you are carrying the psychological burden of believing your brain is damaged, even though your cognitive function may be perfectly adequate for your daily life. Research has demonstrated that when brain scans are performed on healthy adults over 75, more than 90% show findings that appear abnormal on the radiology report. Yet the vast majority of those individuals have completely normal memory and thinking abilities. Conversely, some individuals with early cognitive decline have scans that appear relatively normal. The image does not reliably predict function. What should you do instead if memory is a concern? There are simple, well-validated cognitive assessments that can be performed in a doctor's office in 10 or 15 minutes. Word recall tests, clock drawing tasks, sequential subtraction exercises. These measure how your brain is actually performing rather than how it looks on a picture. And if those tests suggest a genuine problem, the next step is investigating treatable causes, and there are many of them. Medication side effects. Vitamin B12 deficiency. Thyroid dysfunction. Depression, which frequently presents as memory difficulty in older adults. Sleep apnea, reducing overnight oxygen supply to the brain. Each of these causes is reversible. Fix the underlying problem, and the memory often returns. No MRI required. The third test is routine cardiac stress tests, ordered solely because of a patient's age. This is a situation I see constantly. A senior is scheduled for a routine surgical procedure, perhaps a hernia repair or a knee replacement. Hospital protocol mandates that everyone over a certain age receives a cardiac stress test before surgery. So despite feeling perfectly fine, despite being able to walk a mile or climb stairs without chest pain or unusual shortness of breath, they are placed on a treadmill and pushed to their maximum heart rate while monitoring equipment watches for abnormalities. Think about this logically for a moment. If someone can walk a mile in their daily life without cardiovascular symptoms, what additional information is a treadmill test going to provide? Their daily life is already a stress test. They are passing it every single day. The problem is that stress tests have a notably high rate of false positive results in older adults. The test suggests something is wrong when nothing actually is. Perhaps the heart rate response is slightly atypical due to age or medications. Perhaps an electrocardiogram tracing shows a pattern that could indicate reduced blood flow, but could also be completely normal for that individual. Once the test produces an ambiguous or false positive result, the cascade engages. A cardiac catheterization is scheduled. A catheter is threaded through an artery all the way to the heart. It is an invasive procedure with real risks, including bleeding, infection, arterial damage, and in rare cases, stroke. And what do they frequently find? Exactly what you would expect in the heart of a 72-year-old. Some plaque accumulation, some arterial narrowing, nothing that was about to cause a heart attack, nothing that required stenting or surgery. But now you have been labeled a cardiac patient. New medications are prescribed. And perhaps most damaging, you lose confidence in your own body. Activities you enjoyed, tennis, hiking, gardening with vigor, are curtailed because you have been told your heart is compromised when in fact it was functioning perfectly well for your life. What should you do instead? Listen to your body. If you can climb stairs, walk briskly, and perform your normal activities without chest pain, unusual breathlessness, dizziness, or lightheadedness, your heart is communicating that it is handling your life's demands. Those are the symptoms that warrant investigation. If they appear absolutely get evaluated. That is when a stress test provides valuable information targeted at a specific clinical question. If you want a proactive measure of cardiac risk without the cascade danger, ask your doctor about a coronary artery calcium score. It is a quick, low radiation CT scan that takes about 5 minutes. No treadmill, no needles. It measures the amount of calcified plaque in your coronary arteries and produces a single number that quantifies your risk. A score of 0 means extremely low risk for the foreseeable future. A high score means prevention strategies need to be prioritized. It provides actionable information that guides decisions rather than triggering a chain of invasive procedures. The fourth test is routine screening colonoscopies after 75 in individuals with no special risk factors and a history of normal prior screenings. And I want to be very careful with how I present this because colonoscopy is genuinely one of the most valuable cancer prevention tools in medicine. I recommend it enthusiastically for adults in their 50s, 60s, and into their early 70s. The ability to find and remove precancerous polyps before they develop into colon cancer has saved countless lives. But every medical intervention exists on a spectrum of benefit versus risk, and that balance shifts as we age. The benefit of a colonoscopy is preventing a cancer that, if it were to develop from a new polyp found today, would typically take 5 to 10 years to progress to a dangerous stage. For someone who is 55 or 65, that timeline makes screening enormously valuable. But for someone who is 78 or 80, that calculation changes. The risks of the procedure increase with age. The bowel preparation, consuming large volumes of liquid laxative solution, can cause significant dehydration, electrolyte imbalances, and weakness in older adults. Sedation carries elevated risk of respiratory depression and prolonged confusion in aging brains. And perforation, an accidental tear in the colon wall during the procedure, becomes more likely as the colon wall naturally thins with age. The risk roughly doubles or triples after 75. A perforation is a surgical emergency that can result in emergency surgery, a temporary or permanent colostomy, and for an older adult can mark the end of independent living. This is not fear-mongering. This is the clinical reality that informed the decision by most major medical guidelines to recommend stopping routine screening colonoscopies somewhere between 75 and 85 for average-risk individuals with a history of normal prior screenings. The math simply shifts. The probability of being harmed by the procedure begins to exceed the probability of being helped by it. If you have a family history of colon cancer, if you have personally had polyps removed in the past, if you have inflammatory bowel disease, those are different situations that warrant continued discussion with your gastroenterologist regardless of age. For everyone else, what should you do? Shift from invasive screening to intelligent surveillance. Pay attention to symptoms. Persistent changes in bowel habits, blood in the stool, unexplained abdominal pain, unintended weight loss, new onset anemia. These are red flags that warrant immediate evaluation, including colonoscopy regardless of age. Symptom-driven investigation is always appropriate. And invest in the most powerful colon protection available, your diet. Dietary fiber from fruits, vegetables, beans, lentils, and whole grains feeds the beneficial bacteria in your gut that produce compounds directly protective against inflammation and cancer development. Eating more broccoli, more berries, more oatmeal, more legumes provides continuous, lifelong colon protection with absolutely zero procedural risk. Let me bring this all together with the principle I want you to carry with you from today forward. Health after 60 is not about having perfect test results. It is about function. It is about being able to do the things that give your life meaning. Playing with your grandchildren, walking through a park, reading a book, cooking a meal for someone you love, maintaining your independence, your dignity, and your joy. And sometimes the best way to protect those things is to say no to a test that would send you down a cascade of procedures, anxiety, and complications that you did not need. I am not suggesting you avoid all medical care. I am suggesting you become an informed, empowered patient. When a test is recommended, ask your doctor 5 questions. Why specifically do you recommend this test for me? What happens if the test finds something? What are the risks of the test itself? What would we do differently based on the results? And is there a less invasive alternative that would give us useful information? Those 5 questions will transform your relationship with your healthcare. They will ensure that every test you agree to is truly serving your health rather than simply following a protocol that was designed for a population rather than for you as an individual. You are in charge of your health. Not the computer alerts, not the checkbox protocols, not the institutional momentum that moves patients through a system. You. And the more you understand about what you are agreeing to, the better your decisions will become. If this information made you think differently about medical testing, share this video with someone you care about. A parent, a friend, anyone who might benefit from asking better questions at their next appointment. Leave a comment telling me whether you have ever felt pushed into a test that did not feel right. I read every response, and your experiences shape what I cover next. I am Dr. Charles Anderson. Subscribe to this channel for more honest, practical conversations about health after 60. Take care of yourself. And remember, sometimes the healthiest thing you can do is ask one more question before you say yes. I will see you in the next video. One final thought before I go. I have spent my career watching the intersection between medical technology and human well-being. And what I have observed is that we have become extraordinarily good at finding things inside the human body. Our imaging technology is more powerful than at any point in history. We can detect abnormalities measured in millimeters. We can identify variations so subtle that they would have been invisible to every generation of physicians before ours. But our ability to find things has outpaced our ability to know which findings actually matter. We are drowning in information and starving for wisdom. The question that should guide every medical decision after 60 is not what can we find, but what should we look for? And, more importantly, what will we do with what we find that will genuinely improve this person's life? When the answer to that last question is unclear, when a test is more likely to generate anxiety and procedures than to change a meaningful outcome, that is when the courage to decline becomes an act of self-care rather than negligence. I have watched patients in their 80s who refused unnecessary testing live with a peace and vitality that eluded their peers who spent their final years shuttling between specialist appointments and imaging centers, chasing findings that were never going to harm them. I am not romanticizing the refusal of medical care. I am observing that quality of life is not an afterthought. It is the entire point. And protecting it sometimes means having the confidence to say, I feel well, my body is functioning, and unless there is a specific reason to investigate, I choose to continue living my life rather than searching for problems that may not exist. That confidence comes from knowledge. And that is what I hope I have given you today. Not fear of medicine, but respect for the complexity of your own body and the understanding that not every available test is a test you need. You have earned the right to make these decisions with full information. Use that right wisely, and your years ahead will be richer for it.